Hi, everybody. If you're listening to a recording, our family is together lifting my sister and her family up as they experience a devastating loss. I want to thank Liz and her team in thinking outside the box. Liz is going to capture and share all of your comments and questions so that the BH team can reach out to you. My name is Erin Meyer. I am the founder and president of Basils Harvest, and I do refer to Basils Harvest as BH. So if I say that, you'll know what I'm talking about. I'm really excited to be here and to share with you a little bit about who Basils Harvest is and what we're doing, and to introduce a white paper that we worked with the Croatan Institute, David Lazaks, in putting together around the regenerative agriculture and human health nexus insights from field to body. So what brought this talk together is that I am a member of Illinois Stewardship Alliance, and Liz Ruppel was leading our soil caucus meeting one day, and we were going around the room sharing updates. And I happened to share a project that we were leading that's called Regenerative Farm to Institution. And it's working with folks along the value supply chain, think farmer, mill, distributor, hospital. And along with that on our team is the Rodale Midwest Organic Institute, and they're investigating soil health and nutrient density. So after the meeting was over, Liz reached out to me and shared what was happening this week with Soil Health Week. And I was really excited to be able to share a little bit of what we're doing and what I've learned and what our team has learned over time. And so, Liz, like I said, I want to thank you for thinking outside of the box and figuring out how we could do this. And again, I am so sorry I'm not with you, but please share your questions and your comments, and Liz will be sure to get those to me as soon as possible, and I will get back with you. Figure this out. Okay, next slide. Sorry about that. So what I'm going to mention here as we get going is that I'm not a farmer, but I am a chef RD and a food systems professional. As I was thinking about being part of the caucus and reached out to learn more about the caucus, I originally thought that I was the only non-farmer on the team, but what I learned later through Liz and meeting everybody is that I'm one of 3 farmer advocates. And when I joined, I thought about, is this the right caucus for Basils Harvest to join, to have a small voice with ISA, as ISA really promotes their vision and their work to change how farmers are farming and how eaters are eating, and really looking at regenerative agriculture and soil health. I am an eater. I embrace my background as an environmental dietitian. I think about health and wellness and that little pesky thing called the gut microbiome. I'm also a chef, and so I don't only think about, how to cook food, but I really think about how food's being grown, and I think about the seeds and the varieties and what the end product's going to be coming out of the field, in addition to what the impact's going to be coming onto your plate for people to enjoy it. And I'm a food systems visionary, really thinking about regional value chains, farmer soil equity, community resilience. What I've learned, similar to all collaborative approaches, a multidisciplinary team is vital to create a paradigm shift in a system. So I'm really excited to be part of the Soil Caucus and to be able to share a little bit with you what we're doing. So during our time today, I'm going to share a little bit about my background that moved me into the path of regenerative ag and the human health connection. I'm going to introduce Basils Harvest Farm to Institution Initiative. I'm going to talk about the regenerative ag to human health nexus, the paper itself, the concept, and the evidence. It's really an uplifting paper that doesn't provide solutions, but it provides a place to start a discussion for all people in every realm that they support. I'm going to share a little bit about our work in and around the Nexus, and then a few key takeaways in how you, as a leader, as an eater, can help to move the regenerative ag to human health nexus forward and what your role is in that. So moving forward, sorry about that. I will get this, I promise. So in an interview with Brene Brown, former CEO and author Douglas Conant said something that really opened up my eyes in leadership. And I'm going to paraphrase. Our leadership stories are defined by our life experiences. You know, I look at this next slide, and this is a little bit about my food stories that has moved me forward into my leadership roles. However, when I look at this slide, I see two things. One, I think the first thing that should have been on here was that I am a softball player. You can remember when I wasn't a farmer? I didn't grow up on a farm. I played softball from a very young age through college, where I believe the importance of teamwork, discipline, and strategy building began for me. From here, I'm going to share a few life experiences that really walk you through these different steps in my life, from a registered dietitian to a chef, to the wannabe farmer who shouldn't, and to a food systems visionary. And the picture on the right really showcases the quote, the wannabe farmer who shouldn't. I don't think I have to explain that any further, but it was a lot of fun for the Christmases that we were able to share this title as our Christmas letter. So as we look at this slide, there's a lot of pictures. I just want to highlight a few. And in my journey, if it weren't for my attempt at nursing school, I wouldn't have found my path to environmental nutrition. If it weren't for wanting to provide more creative culinary nutrition ideas and options that meet my patient needs, their culture, and their interests, for me as a certified diabetes educator, I wouldn't have gone to culinary school. And in all transparency, I also wanted to learn how to cook. You know, who can be a dietitian if they don't know how to cook? Though it would stop my husband from going to McDonald's also. So, you know, two birds with the one stone kind of thing. If it weren't for two little girls named Emily and Maggie, an employment position that was eliminated, and a small farm, Basils Harvest Kitchen wouldn't have been born. And I wouldn't have built relationships with farmers and shared my passion for education, good food, and changing a system. And if it weren't for my neighbor, I wouldn't have learned how to care and keep my John Deere tractor going. I'm sorry. I wouldn't have learned how to run water lines and electricity for the animals, the hoop houses, and the garden. Remember the sheep picture? I wasn't very good at electric. It's because of all of these life stories and experiences that has brought Basils Harvest forward to the nonprofit that is advocating for a new shift in our food and farming system. Basils Harvest exists to nurture a more healthful, equitable, and resilient food system. We do that by lifting up the crucial connections between the health of people, farms, and soil. We take a systems approach to help clarify the interconnections, to better understand and navigate the complexity and influence system dynamics for more powerful and durable change across the farm, food, and health systems. Our vision, which I think you're going to have trouble reading in the slide, is that through our work and what we hope to see is a vibrant and equitable food system supporting diverse farming families, resilient ecosystems, and community health, and that all rural and urban communities understand the connections between food, farm, and health and can regularly access food grown regeneratively and prepared with care while embracing their roots. Our ongoing initiatives and the interventions or lenses that we work through, there are two. Building ecosystems. We convene intersectionally across the food system, farm, institution, and healthcare industry leadership so that we can foster strategic and collaborative ecosystems that'll bring change about and more impact around regenerative value chains. We work to empower new leadership through experiential learning. We couple experiential learning with actions to increase leadership awareness of the connections between soil health, crop nutrient density, and health outcome indicators. Briefly state, 3 of our initiatives right now include our regenerative ag in the Heartland Initiative, which I'll be talking about, our ecosystem research initiative, which is connected to the regenerative ag initiative, and our culinary medicine program with the University of College of Medicine at Peoria. Those interventions throughout the system lead to these outcomes. More farmers are motivated to adopt regenerative agriculture practices. Institutions serve regional regenerative food. Healthcare leaders acknowledge connections between food, farm, and health. Leaders in food, farm, and health systems examine and understand the connections between planetary and human health. Legislators advocate for policies that promote healthy, equitable, and regenerative food and farming systems. And new and regenerative markets are developed all across the different sectors. So in reality, let's take theory and put it to action. If we look at this slide, the regenerative value chain from farm to hospital, this was our Regenerative Ag in the Heartland Initiative, where we worked with Janie's Mill and Janie's Farm and Cow Creek Farm in East Central Illinois. We partnered with OSF Healthcare, St. Francis Medical Center, and the Rodale Institute out of Iowa, their Midwest Center. And our goals here were to learn and to develop a regional supply chain with farmers growing regenerative organic oats, going to Janie's Mill to be flaked. From Janie's Mill, they were going into the hospital, delivered to the hospital, would go on patient trays, and would go into the employees' cafeteria. In addition to making oat granola, and down the road, those oats will land in the gift shop so that employees and visitors can purchase them. We learned a lot. In the end, we did get oats into the hospital, which was wonderful. We learned a lot. We initiated with Rodale our soil research program, really looking at 4 different sectors of ground, from T1, transitional 1 farm ground, to organic that's been certified for 5 years, 15 years, and 25 years. These are a few pictures. This was developed from scratch, and we had to learn from the farming. We learned a lot of lessons in growing oats in East Central Illinois. We learned a lot of lessons in creating a new infrastructure within a flour mill to bring in a new piece of machinery and to get that up and running, to get the quality that met the standards of the mill and the hospital. And then working with the hospital in the steps that needed to happen, from procurement, getting those oats in the back door, testing the oats and how they needed to be cooked because they might be different than what's been cooked before, and figuring out and understanding how to manage the cost of the oats because they're more expensive than the oats that the hospital was purchasing. So one of our goals was not to have any waste. So there was some R&D that was happening in the background also. So if you look at this by the numbers, of the farms involved, there were 5,700 acres that were planted, certified organic and regeneratively grown in East Central Illinois and in Moorhead, Minnesota. The one thing that was really important about this project is that this was building a regional food system. And what we had to think about as in creating regional food and farming systems, if something happens and you lose a crop or you don't have as much as you need, you know, instead of going into the commodity market, we want to support other regional systems. So it's all based on relationships. So we built a relationship with Doubting Thomas Farm in Moorhead, Minnesota. And of the 5,700 acres, 300 acres of oats were harvested and utilized and available for our initiative. The total oats harvested were 462,000 pounds. So you can see that they're going into a lot of different markets and being used for different things in addition to what we're using. Regarding the nutrient density of these oats, the antioxidant level in oats are twice as what they are from the Quaker oats. And these are Doubting Thomas's oats. With the hospital, they will purchase over 4,000 pounds annually, with conversations happening to expand into the additional 14 healthcare institutions within their entire system. And so for the first step into this initiative, and it is small, and we know that, and we've recognized that, the hospital will be purchasing about $5,000 of oats a year. Like I said, with the goal to increase substantially into the entire system of OSF over time. The other part of our initiative and our work is the Ecosystem Research Initiative. We are supporters in this. We are not researchers. Carl Rozier is a soil scientist. He is a collaborator with Basils Harvest and the Brodale Institute, the Midwest Organic Center. They were a part of our initiative, and our goals within our initiative was to look at the health score, determine the microbial activity, really looking at the links between management practices and nutrient density of grains. So within that, we have completed 2 years of our soil health initiative. We're going into our 3rd year, and where we are going to be getting the results of our DNA sequestration. It's in the queue with the University of Delaware right now. In addition, this year, we are building out our 3 to 5 year plan around the Ecosystem Research Initiative with our collaborators. You know, as we look at this and we think about this research, we knew between the research and the idea of developing these regional models for institutions and our strong interest in the nutrient density of the crops that's being grown, we knew that this research initiative is for the long game. And we're not going to see major results in a short period of time because we're following and looking at it as it transcends over time, right? And so there were questions that we had because we weren't going to see the results of, you know, what is the nutrient density of the crop? What does the soil health look like? What does the biology look like? And so one of the things that we were talking about is that we're saying, and we believe that the way that we manage our soil and the way that we grow food and the way that we, you know, harvest that food and we process that food, that it seems logical that the nutrient density would be stronger, that food would be healthier. But like I said, we're not researchers. So we reached out to the Croatan Institute and we asked David Lizax and his partner, Mandy Ellerton, to investigate the evidence, to look at, what is being said out there? What is the connection between soil health and human health? And while the summary or this paper, it doesn't provide the answers to the questions that we were asking, but what it does do, it discusses this concept of regenerative agriculture and the human health nexus. And it highlights what other organizations and partners are doing within this realm. And it's also an opportunity that wherever you sit in the food and farming system, that we need to be thinking about this. And if you've noticed, as you sit within this system, that there's a lot of buzz around regenerative agriculture, soil health, and human health. And when I say buzz, I mean evidence-based research that's happening. And so as we get into this paper, I want to share with you an overview of what David and Mandy really discussed and brought forward, and some key highlights of what they discussed and brought forward. And as we look at this, the idea that ag practices and soil health have a connection to human health, it is gaining energy and attention. Like I said, there is a huge buzz around the evidence-based research that is happening. And it's so exciting that there's a movement emerging. Rodale, the Power of the Plate, the Bionutrient Institute and the Bionutrient Association, and the research that they're doing in collecting samples of foodstuffs from across the globe to see what is the impact of nutrient density based on the way that you're farming. And if this movement envisions transforming our agricultural system to transform our health, then there's just the opportunities and the importance of this work is exponential. And if these implications are realized between agriculture and human health, it could transform across the food, ag, health, and the broader environment. What this paper explores is the evidence connecting agricultural practices to human health outcomes. Through this evidence that Mandy and David reviewed, there's a number of reflections. First and foremost, that growing more nutritious food does and will influence human health, and that we have a lot of work to do to transform these systems and to maximize the potential that more nutritious food has to offer in the realm of human health. As the Rodale Institute Power of the Plate says, this link between soil health and human health is largely unexplored and it must be advanced. And it's important to know that the connection between human health and ag practices is infinitely complex and dynamic. If we go to the next slide. As we look at this, the concept around this paper, and we're engaged in these conversations around regenerative agriculture and how it benefits climate, biodiversity, water, and building community wealth. We're also talking more and more about how it can benefit human health too. Because if healthier soils lead to more nutrient-dense foods, then it can be assumed that it's going to lead to healthier humans. The evidence that the microbial health and diversity of soil is connected to the microbial health of humans. They're seeing that evidence. In fact, I'm going to talk about this in a little bit, but the University of Illinois Regenerative Ag initiative brought together on our team a group of researchers that are really digging into, what is being said about the gut microbiome and the soil microbiome. And what they're seeing is that the vocabulary being used within each system is very similar. And that is what they're focusing on right now, are the known knowns and the known unknowns, but it's something that it's the starting point, and it's the beginning of where a lot of people are. And as we talk about this, that regenerative agriculture is connected to human health, we're also talking about different things. So it's not just how we grow food, what happens to the end product. We're taking you through a framework today to understand the different levels of nutrition intervention. And all of these interventions are used at one time or another by leaders and organizations within this movement, within healthcare, within farming, as we see these. And these 4 levels of interventions that I'm going to start with, in terms of the health and well-being of humans, David Lizax and Eric Jackson developed these interventions. And depending where you are in your area of expertise along the food system, you might see the diagrams through a different lens or a specific lens. As a dietitian, I initially saw the framework through the lens of how the categories can have an impact on disease and well-being, and where my patients or clients started and where their growth, how it expanded. As a food system professional, the categories explore a very complex system that's needed to improve outcomes across the interconnected environment, ag, food, and health systems. And if you look at this, level 1 is replacement. And if what you're seeing on this screen, you've got a bunch of processed foods that people eat every day. You can see all the white flour. You can see limited vegetables. You can see fried foods, ultra processed. We live in a very fast-paced pace, I want it now life. And if we look at replacing those foods with whole foods, the thing that I want to say as a dietitian is that it's not a 180. We don't flip, but what we might see wherever our clients start is by decreasing versus replacing. And so we might see that in a CSA veggie box. We might see it there. We might see it in an outpatient office where you drink, 10 Pepsis, and you're going to decrease that to 6 Pepsis, and you're going to add a whole fruit. Or maybe you drink, 30 ounces of orange juice a day, which is a processed food, and you're willing to cut that back to 16 ounces, but you're going to also add an orange. So the replacement, it's a combination as decreasing your current food choices and replacing them and working towards an increase in replacing them to whole foods. The second level, we're removing chemicals and drug inputs from agriculture and food production. So you're going for, buying conventional ingredients at the grocery store to organic ingredients, as an example, or you're going to a farmer's market and you're building a relationship with your farmer and you're asking questions about how their food's grown and do they apply chemicals. And so you're starting to build awareness. And along with that, as you move into level 2, you're continuing to decrease those processed foods and moving into whole foods. Level 3 and level 4, we see this as the next 2 levels that really we need to be focusing on, because right now the majority of people live in level 1 and level 2. Level 3 and level 4, we're looking at, the nutrient density of these foods, how the soil is taken care of, and the impact to the end product. Are those oats more nutritious than oats that you buy off the store shelf? Are these carrots more nutritious than, a conventional carrot, a carrot that you just buy at, let's say, the grocery store, and it's not organic? You don't know how it was farmed, so looking at that. Level 4 goes to a different level, which actually is gaining popularity. When this says microbiome centric, I think of fermentation. And fermentation is becoming more popular over time. And, in terms of the microbiome, over the last 20 years, we've gained a better understanding of the role of the microbiome in the environment, around food, and within ourselves. We're looking at strategies that are emerging to create a vision of a more harmonious relationship between microbiomes in the environment, in agricultural systems, in food, and in ourselves, in our bellies, in our gut. Last week, just for an example, I was creating recipes that contain plain yogurt, whole fruit, and kombucha. If you think about what is, the microbiome, and how do we increase the microbiome in the environment, around food, and within ourselves, like I said, it's really picking up interest across all different areas, and we're really starting to talk about it, and that's exciting. Right now, as I said, to reinforce, most of our time and energy is spent on level 1 and 2, but we need more conversations, more energy spent, and more funding supporting the growth of level 3 and 4. This section really is the flow from how we farm and increasing the nutrient density of food through harvest, purchasing, digestion, and human health. What we want to do is we want to think about the journey the food takes, not from field to body, but starting at your body and then going back to where it starts. So as we do this, we need to be able to access, assimilate, and use these nutrients. So I'm going to briefly walk through the highlights. And as we walk through these highlights, I want to encourage you to harness your thoughts, your ideas, and your questions as you see them through your lens, whether it's a farmer, an eater, a policy maker, a legislator, a physician, or a dietitian, or an advocate. If we think of that last slide, which was human health, we're connecting the dots between food, farm, and health, or regenerative agriculture to human health, or healthy planet to healthy humans. No matter how you define for yourself or organization, in this paper, it comes down to human health and how it pertains to agriculture and food. Our body needs inputs, and we can't overemphasize how much our body's functioning requires inputs, nutritional inputs. And if you think about that, intervention number 1, if we're inputting those processed foods, there's not a lot of nutrition for our body to pull out of there. So it's essential, it's crucial for us to have an understanding about how nutrition relates to our health and well-being. So we need those nutrients to be healthy. That means that the opposite is also true. Nutritional deficiencies are associated with chronic health issues. Each of us, we are very unique. We are composed of a very complex and dynamic interactions between genes, the microbiome, what nutrients are already present in our body, and even culture and preferences. We have to remember that these changes happen throughout our lifetime and that our body's needs change throughout our lifetime. You know, we eat to sustain ourselves, but we also eat to feed our microbiome. As you watch the research unfold on the human microbiome, and there's still much more to learn, but we know the disruption of the human microbiome, especially the gut microbiome, has been linked to issues besides obvious intestinal issues. We're starting to see that it's connected to chronic health issues, mental health issues, autoimmunity. We eat to feed ourselves, but we also eat to feed our microbiome. But how do we do that efficiently and effectively to get those nutrients into ourselves that properly feed our microbiomes? So let's go back to where this journey begins. And where does it begin? Sorry. It begins into more nutritious food. How soil is taken care of, how it builds nutrients, how it builds soil health, and how that health impacts the plant health, which impacts the food stuff that's harvested. And if you think about that right now, the target from governments and many businesses have a focus on quantity, not quality. More cheap calories. That has been a detriment for the environment and our health. Think back to the cost of foodborne diseases. You know, I want to share with you not only foodborne diseases, but chronic diseases caused by how we're feeding ourselves. And if you look at food-related diseases, the cost of disease that's impacted by the foods that we eat is astronomical, and it's just increasing. Cheap food is actually very expensive, and it's rooted in our food system's orientation to optimize toward a very small number of outcomes while externalizing social and environmental costs. So as the rates of diet-related chronic disease continue to increase, with healthcare costs raising in tandem, these voices are seeking to raise consciousness that the declining soil health, fertility, and biodiversity are linked to biome dysbiosis, nutrient loss, and poor nutrient processing, which disrupts optimal nutrient uptake across the food web. And we believe this plays a role in the significant rates of illness and degraded health that we're seeing today. So as we grow our food, we also have to harvest it. We have to process it, right? This area, in all honesty, we need more investigation in this area. There are examples of supply chain technology that impacts the delivery of nutrients. And an example of that is how we mill grains. Typically, grains are milled where much of the nutrition in the wheat is taken out. It's separated from the bran of the wheat kernel. So this is called roller milling, and this technique efficiently separates those components out and creates shelf-stable products. And milling is just one example of commonly used supply chain technology that impacts the delivery of nutrients, versus stone milling, which takes that whole seed, that whole kernel, smashes it and mills it. And so what you're seeing is that the germ and the bran doesn't leave the kernel, doesn't leave the seed. It's incorporated into it, so those essential nutrients are in the product. There are more examples within the paper. The next piece of the paper and of that linear diagram is just because farmers are able to grow incredible nutritious food, it doesn't mean that people can access it. So as we look at purchase, access, and preparation, I want to highlight something that is truly important to the ability to purchase, access, and prepare food, and that's food apartheid, and it's real. And it refers to systemic racism and inequities that make it harder for some people, in particularly Black, Indigenous, or people of color, and rural people to access high quality food. And that means in some communities, there are very few grocery stores and even fewer that are accessible with public transportation, or in the case of a rural community, without a very long drive. One's only option for buying any kind of food whatsoever is often a convenience store or gas station with very limited fruits and vegetables that are fresh, let alone high quality foods grown with regenerative practices. And to top that off, we know that regeneratively grown food is often more expensive. We believe that that cost is due to systemic issues that keep conventional foods artificially cheap, but the fact remains that today it's more expensive. In addition to accessing and purchasing this food, preparing it, it's another equity dimension that relates to access. The ability and capacity to prepare it, to have time. Because if you're purchasing regeneratively grown foods, typically you're doing more from scratch cooking. Those are whole foods, and it's breaking down that food and creating a meal. What does that mean? It means more time, more energy, and more equipment. People living in poverty have less time and energy to devote to this kind of preparation and may also lack the equipment. And it's also a gender issue. It remains true that women do the majority of caregiving and housework, and food preparation disproportionately falls on them. In all these cases, when time and energy are short, it makes it pretty desirable or even necessary to turn to processed or ultra processed food to get by. You know, if we have it, we have that food and we eat that food, then we're digesting that food. A healthy digestive tract is vital to the digestion and absorption of those nutrients. It might be a no-brainer or might seem like a no-brainer, but it's really often overlooked. If the gut is damaged, it stands to reason that you would have trouble unlocking and pulling out and taking all those nutrients into your system to maximize their role that they need to play. What impacts the gut? We know that chronic stress and trauma can exacerbate digestive problems. You know, I don't know if you've heard the term nutrition trauma. This was really interesting that was found as the research was happening for this white paper, but it's the idea that the lack of access to your cultural group's traditional foods can significantly damage your digestive system with compounding negative effects, especially over the generations. Considering that most of us have been stripped of our cultural food traditions, especially Black, Indigenous, and people of color, we all likely have some degree of nutrition trauma. And once that gut is damaged, it's very hard to heal. And being very hard to heal, there is some research happening and talk about extinction, meaning that if you've lost crucial bacteria, it may not come back. So as we think about this paper, and I really encourage you to dive into it, some of the reflections that came from the paper, that growing more nutritious food does influence human health. Not only growing more nutritious food, but eating more nutritious food. And even if we're starting at level 1 and moving to level 2, and we know that there's more work that needs to be done, and we need to advocate to move to level 3 and level 4 so we can see how we can connect the dots between farm, food, and health. Another reflection that regenerative agriculture to human health calls for an inclusive and collaborative movement. That race and gender equity is crucial. It's a huge piece of this. And that we need a new vocabulary. We need a paradigm shift. And we will never, ever understand all of the impacts of nutrient density on human health. It is so complex. It is so detailed. We are just beginning to peel the layers of that nutritious onion back. So my call to you, but wherever you land, we're all eaters. We all have conversations that are key every day. But my question to you as a government agency and policy, as a healthcare professional or within the healthcare system, as a farmer and looking at land management, what is your role? What is your call to action? It can be a plethora of things. You know, it can be championing soil health initiatives and state legislation that supports resilient food systems. Healthcare, getting curious about regional and regenerative procurement in your healthcare institution. As a CEO of a hospital or a hospital system, asking what the sustainability goals are. You know what they are, but getting your team and the healthcare institution together to start having these conversations as a starting point. As a farmer and managing your land, as a farm land owner and managing the land, getting curious and exploring conservation and regenerative growing methods. It doesn't matter where we start. There's a lot of different places that we can start. If you're an educator, build out a section on regenerative ag and human health within your classroom. Get people talking. One thing that I want to highlight, and I mentioned this earlier and just quickly in our time together, is that the University of Illinois Regenerative Ag Initiative, our team, and this is our team here, the Coalition of Regenerative Agriculture, Food and Health team, we're comprised of healthcare system, research scientists, and the farm and fooding industry, with a goal of building a model that connects viable regenerative farming, enhanced food quality, and improved human and environmental health outcomes under climate change uncertainty. What we're looking to do is to bring a multidisciplinary approach to build relationships across siloed systems to increase capacity in research in soil health, the gut microbiome, and production and consumption of healthy foods. Ultimately, this will lead to increased acreage and resilience of regenerative agriculture, improved human and environmental health, and economic empowerment of stakeholders. To learn more about our work, visit our website at basilsharvest.org. Another place to learn more and to become involved is Regenerate Illinois Network. If you are not part of the Illinois Stewardship Alliance, join the Illinois Stewardship Alliance as an eater, as a professional, as an advocate. You can learn more at the Rodale Institute, their Midwest Organic Center, the Bionutrient Institute, I mentioned them today. There's a book coming out in June by researchers David Montgomery and Ann Beal, What Your Food Ate, and you're starting to see some of their research pop up in journals. People are talking about this. And it's real, and it is that connection between regenerative agriculture and human health. And as we bring this to a close, I want to thank you for staying on with me throughout this process. I want to tell you how sorry I am that I wasn't live and that I didn't see your questions and your comments or your faces on the screen. For as long as you were able to stay as part of this conversation, it's an important conversation, and I look forward not only for myself, but for the Illinois Stewardship Alliance and their teams and their caucuses to get involved, for you to get involved with them and to continue these conversations. And I'll end on this quote: "The soil is the great connector of lives, the source and destination of all. It is the healer and restorer and resurrector, by which disease passes into health, age into youth, death into life. Without proper care for it, we have no community, because without proper care for it, we can have no life." Wendell Berry.